This is Scott McDonald of Dr. Demographics, and today we're going to be talking about medical centers, places where there are clusters of doctors in an environment where there are several offices. And they sometimes call them professional plazas or medical center plazas. You get the idea. Very often, the reason that they existed and became very popular, well, frankly, in some parts of the country, the reasons are disappearing. Now, I'm not suggesting you shouldn't consider putting a practice in a place where there are lots of other offices. Sometimes there are dental specific or optometry specific, or you may have a group of general practitioners of healthcare, and sometimes it's a cluster of specialists who are very close together. There are good reasons for them, but frankly, I want you to think hard and long about this because the reasons that they existed are, well, kind of changing and sometimes disappearing. Some of you may be discouraged that it appears as though they're already full and that most of the new medical healthcare practice locations are converting to more of a retail character. I want to talk to you about why some of these things are happening and what to do about them. So, we're going to talk about the medical plazas and what you want to know about them. Now, there was at the beginning a mandate to put healthcare practices close together. It was a little bit of self survival because you see, a retail center, the basis of how you charge by square footage, is not exactly how healthcare practice sites got started and why they were sustained for so long. The model or the rationale to have them changed over time, and I want you to be aware of them. Now, they used to be known as Pill Hill, and every small town had a Pill Hill, and that was the place where medical practices were always located. And there were good reasons for that. The reasons that professional plazas existed are still real today. But as I mentioned, the reasons are disappearing and changing. And that is going to affect how much they're charging for these. Now, why were they started at all? Now, look, you have to go back into the 1980s, well, before the 1980s, 1920s, 30s, and 40s, even 50s and 60s. This was also true. They were the source of your referrals. So a general dentist might have had a physician friend who he was receiving referrals from, even though a dentist typically doesn't depend upon referrals from a general practice healthcare practice. But it was true, nevertheless. If you clustered them together, there was a benefit of referrals. Keep in mind also, advertising was severely limited by the American Medical Association, the American Optometric Association, the American Dental Association. You couldn't hang a shingle. And one of the reasons that you wanted to do this is because people who were already looking for healthcare knew where to go. Promote your practice. Even though they were not necessarily formal referrals, they were incidental referrals, and people could decide that they'd say, yeah, that's where I need to go. Now, they were convenient. They were centrally located in a healthcare neighborhood. If you were to look in a place, and there's so many of these in those neighborhoods that were developed, particularly in the 70s and 80s, Coyle Avenue in Sacramento, California is a good example. They became really the place that you needed to go. Coyle, by the way, was a guy who was a physician, and his son was a physician, and his grandson was a physician, and his great-grandson became a dentist. And, well, Coyle Avenue is developed as a healthcare site within Sacramento. This has repeated itself time and time again. But as people got aware of the idea that this is a healthcare location, they would naturally assume there's more credibility for practices that were existing in those sites. With that in mind, there were simple factors like parking. You know that most of these places do not have paid parking, at least not in urbanized areas, maybe they do, but in more suburban sites and certainly in rural ones, free parking is the norm. And parking that was available during the evenings were usually well lit and safe. So people thought, yeah, this is a great place for us to go. It became a good place because that's where good doctors were. Everybody knew it. But there's also things like sales convenience. And when I say this, you know that suppliers of healthcare services, masks and gloves and things, pharmaceuticals, the salespeople used to be able to go office to office and sell their wares, and they were a convenience, a significant convenience before we had online shopping and before you had big aggregators of healthcare products and services. So that you had a computer company that was doing computer software management through their Apple IIe, perhaps. They became the normal place to get all kinds of services. But as the industry became more mature and services were more easily automated through telephone sales and computer sales, the necessity of having a sales force have access to the locations you were in just kind of disappeared. Access to labs and other vendors became important. Now, remember, these medical centers had a medical lab, a little phlebotomy center. They had all kinds of x ray buildings, for example, because the machines, the equipment was so expensive to have, so that they centralized the equipment. That has been changed significantly over time. The building ownership and the low cost and expense of having a professional office building became huge. Now, remember, in the olden days, selling a building was rather scary, and most buildings were not plumbed so that you could have electrical and plumbing, vacuums systems, and you had to have a building that was already pre plumbed for that purpose. These centers had that, but it's not quite as necessary as it used to be because of the practice designs or the office designs. It became also true if you were not in exactly the same business, like selling an optometry practice to a dentist, you really had to be in kind of vibe about what was reasonable to buy and sell. A building and a practice would go on. Certainly, there were accountants and bookkeepers that were working in healthcare, and it was really easy. But you see, as automation has entered the scene, it's become far less significant in how these things became ubiquitous almost everywhere. Now, I'm not saying that these things do not currently exist, they certainly do. But the demand or why they had to exist previously became a bigger deal than it is now. Now, is it a continuing trend? The ultimate truth is that all these reasons for professional offices, plazas, and healthcare developments, whatever, are still there. There was a time that almost every professional office had to be close to a hospital because advanced diagnostics and surgeries had to be done out of a center where a surgery center was almost impossible. You couldn't set it up. But now the record keeping, the equipment, the sterilization, the waste disposal, bio waste became more professional, more easily distributed. But the habits of consumers has changed over time to affect the desirability of being in one of these medical healthcare practices. And the number one I'm going to go into is the need for visibility among other professional offices, and it's gone in decline. Now, I'm going to go back to the days in which you, as a doctor, had to have a little shingle, and sometimes it was no bigger than 8 inches, 12 inches long. And that was your signage. That was all you were permitted. But of course, that changed over time. But it's changed again as to the sensibilities of the population. They don't like signage the same way they used to, with the whole wall be taken up with the name of the practice. The retail spaces that exist now, and that is the trend that is going on in healthcare, particularly private practices, they're much more expensive than they were previously. Now, that's because the lease space on a property often includes how many parking spaces you're allotted. And sometimes they're protected by signage and other factors. In urban areas, densely populated places, these retail spaces are much more expensive than they previously were. Hey, do you remember when you had to have park validation and how much that cost? Well, retail spaces don't have that nearly as much as they used to. And for that reason, the expenses, the overhead of having an office in a retail space has changed. Now, signage issues are more regulated than before. And this often gets pretty complex. So, in other words, if the other tenants within the office park, the doctor's office plaza, they get pretty regulated, pretty tough. It's written into your lease very often how large, how garish the sign might be, and even what its contents might read. So, signage issues are still an issue when it comes to healthcare office space. Cost efficiency varies greatly. In other words, sometimes signage will be at a premium and really valuable, and sometimes not. And that's because of the exposure of these offices to drive by traffic. One of the things I started my career doing was examining the visibility of office space to determine whether or not a practice would be benefited by having this particular location. Now, you probably don't know this, but in the world of real estate for healthcare offices, used to have a premium on the armpit, meaning is it at, where two buildings are meeting together, where signage is more visible, where parking is easier. These were pretty big issues. Now, going back into this suburban cost efficiency, it tends to trump urban cost efficiency. So, what we see is in medical plazas that are in rural locations where several offices are coming together, and usually 3 to 5, or where you're in a suburban location where the population is not really a big factor with people driving by the site, the jury's still out on whether rural sites are going to be better than a suburban site. But one of the things that we take into account are called GRPs, or gross rating points. Now, I don't know if you know this or not, but all offices and signage is ranked based on gross rating points. The more points you get, that means the more visibility that site will have. And now they're dividing the GRPs into day part. Is this an office that gets lots of visibility during the day, afternoon, or even evening? And the differences are often lighting and security for the site. So keep that in mind. That's one of the things you ought to know. Now, I have always said, and will continue to say, that when it comes to negotiating a location, you've got to have a good attorney and or a good broker who's going to be absolutely necessary in forming the practice's modus operandi. There are factors that you don't know about that you need to when it comes to picking out a location, not just for the desirability of its visibility, but also the factors of how the building itself is valuated. Yeah, I know square footage is something everybody knows about, but do they? Because there's often a difference between the office space for records, computer equipment, diagnostic equipment, and other spaces in which patients will be seen. How large these operatories are, or treatment or consultation rooms are, is something that is important because often they're not negotiated at the same rate. You don't just rent an entire office for everything, but the rates can vary based upon how that area is being utilized. Now, if you want to get in touch with us at Dr. Demographics, I want you to go to drdemographics.com. This is the longer version of this lecture. There is a shorter version, it's only 5 minutes long. But I want to point out two services we've got that I think are particularly helpful. We can do a practice site viability study. So you may come to us and say, well, look, given the population, its demographic character, the amount of growth, median household income, even educational attainment, is this a good and practical place for you to put the practice? And the answer is sometimes yes, sometimes no. Because we're not a broker, we're not trying to make money if a sale goes through and we're worried about it if it doesn't. Our job is to provide you a compare and contrast analysis to say, if you go into this property, is it going to be desirable or not? Now, I happen to have a couple of people that I refer to negotiate leases. And one of them is in Texas, and he is just brilliant. He has thought through so many of the things that you're not even going to begin to know you need to know. He's the one who spent a morning over blueberry pancakes talking to me about triple net. Do you know what triple net is? And do you know why you need to not include factors regarding valuation of the site and modifications of the site for any particular expansion or reduction in the property? I have been surprised how many office spaces have been reduced in its footprint because automation has allowed for the reduction of expensive pieces of property in office space. But then again, I've also seen practices of different types joining together in new office configurations and where they're putting their staff. And this is becoming a real hot button issue when it comes to professional plazas. So if we can help you, give us a call at 833-424-6222, or even better, visit us at info@drdemographics.com with an email or check out our website. We are always available for consultations. Well, not always, but yes, we do offer evenings and weekends to consult with us. So if we can help you have the perfect place to put a practice, well, that makes us happy. This is Scott McDonald, and thank you so much for watching.